Personal protective equipment consists of a long-sleeve water-resistant gown that closes in the back and has cuffs at the end of the arms. Disposable gloves, a face mask with at least FFP2 protection, and safety goggles are also required. Wear a protective head covering if you work with people who are ill. Disinfect your hands before putting on personal protective equipment. Use either a gown that can be disinfected or a disposable one. Have another person check that the gown fits properly. The back of the gown should be completely closed. Next, put the protective head covering on. Then put on the protective mask. Make sure that it fits well. The metal clip should be molded around the nose to obtain a tight seal. Next, put on the protective goggles. Different models are available, including ones that are suitable for people with glasses. Finally, put on the gloves. They should cover the cuffs of the gown. When removing protective clothing, take special care to avoid any recontamination. First, disinfect your hands while they are still in the gloves, since in all probability the gloves are contaminated. Then remove each glove so that the outside of the glove does not come into contact with your hands at all. Now disinfect your hands. Wait the recommended contact time, then put on a new pair of gloves. This time do not pull the gloves over the cuffs of the gown. This would make it difficult to remove the gown. Have another person assist you and open the back of the gown. The assistant should wear gloves and a face mask. He or she pulls the gown over your shoulders. Pull your arms out of the gown by yourself. You should only touch the inside of the gown and not the clothing underneath it. Roll the gown into a ball away from you, keeping the exposed side of the gown on the inside. Then throw away the gown. The next step is to remove the protective goggles. Only touch the goggles on the earpieces or the strap. If they are not disposable, place them in the container that has prepared for them so they can be disinfected. Next, remove the protective head covering along with the mask. Grasp the strap of the mask and pull it over your head. Slip off the head covering at the same time. The head covering as well should only be touched on the inside. The last step is to remove your gloves. Once again, the outside of the gloves should not come into contact with your hands. Finally, disinfect your hands.